The CarbAddictionDoc, Dr. Rob Cywes, says acid reflux triggered by sugar leading to Barrett's esophagitis.
When we eat carbohydrates, either as a sugar or a starch, it starts out in our mouth. And we chew on that sugar. And that sugar in high concentrations affects, first and foremost, our oral cavity and our nasal cavity from two perspectives. Number one, the high concentrations of sugar damage our gums, which are mucous membranes, damage the lining cells of our mouth and of our nasal cavity. Then that sugar goes down the esophagus into the stomach, and in the stomach it encounters acid. So already in the mouth, the saliva is starting to break that down. So there's certain enzymes that are in the mouth that are breaking some of that sugar down, the complex sugar, into its individual glucose, fructose, galactose molecules. But when it hits the stomach, sugar has certain inflammatory effects in the stomach. Number one, there's an overproduction of gastric acid, particularly when you are insulin resistant. You overproduce acid, so you're producing huge amounts of acid. Secondly, sugar relaxes the tightness of the lower esophageal sphincter, this little sphincter, this little regulatory muscle that controls food and fluid entry from the esophagus into the stomach and acts as a one-way valve and should prevent it from going back up. That valve should open to allow things to go down and then contract and stay contracted to prevent things from just seeping back up. So sugar relaxes that muscle. So now you get relaxation of that lower esophageal sphincter. And now, if you've overeaten with the stomach, as your stomach churns, when your stomach squeezes to expel the food out of the stomach downstream, it squeezes both ways. And some of that food goes back up. You get gastroesophageal reflux. And both the acid and the sugar goes back up into the esophagus and sits there and can change the lining of the cells in that lower esophageal sphincter. Because remember, the esophagus is alkaline, the stomach is acid. So what happens is if you've got a lot of acid going back up into those cells, acid burns those squamous mucosal cells of the esophagus, which is supposed to be alkaline. And the way the body protects it, it says, no. Let's change these squamous cells to columnar cells, to the same cells that are in the stomach that protect it against acid. We get a transformation of the mucous membrane to columnar epithelium. While that is resistant to acid, it is a very unstable form of cell. And then acted on by the sugar and the acid, those cells can transform and become precancerous or cancerous, and we call that Barrett's esophagitis. And we see patients with cancer in that lower esophagus from reflux and from sugar and from acid. Acid suppression helps a little bit, but you don't need that if you don't eat the sugar, because the sphincter returns back to normal. So it is very, very common for people that eat a high sugar diet to have gastroesophageal reflux disease and eventually get Barrett's esophagitis. And then you use a very toxic pill to get rid of the reflux acid production, your Prilosec, your PPIs, your H2 blockers, which are now banned in this country for the most part, toxic drugs to deal with the side effects of another toxic drug, sugar. Doesn't make any sense to me. But carbohydrates are by far the commonest cause of gastroesophageal reflux disease. And how do you get carbohydrates into your body? Vegetables, fruits, and as processed foods. Those are the three sources of carbohydrates.
When we eat carbs, whether sugar or starch, it starts in the mouth. We chew on that sugar. In this high concentration, it affects our oral and nasal cavities. It damages our gums and the lining of our mouth and nasal cavity. It goes down into the esophagus and then into the stomach and encounters acid. Sugar has an inflammatory effect in the stomach. It causes overproduction of gastric acid, especially when we are insulin resistant. It relaxes the lower esophageal sphincter. This is a one-way valve that controls fluids into the stomach. When we overeat, our stomach squeezes both downward and upward, so we get gastroesophageal reflux. Both acid and sugar go up into our esophagus, change the lining of the cells in the lower esophageal sphincter. Acid from the stomach burns the squamous mucosal cells. The body, to protect itself, says, let's change these squamous cells into columnar cells. same as we have in the stomach. The change to columnar epithelium, which is resistant to acid, but now they are unstable cells. When acted upon by sugar and acid, they can become precancerous and cancerous. And this is called Barrett's Esophagitis. Patients get cancer from this. Acid suppression helps some, but it's not needed if we simply don't eat sugar, because the sphincter returns to normal. It's common for high sugar diets to lead to gastroesophageal reflux disease, and eventually the patient will get Barrett's esophagitis. If you have Barrett's esophagitis, your doctor may prescribe very toxic pills to cut reflux acid production, things like Prilosec or PPIs, which are proton pump inhibitors, or H2 blockers, which are now prohibited in the U.S., all to deal with the toxic drug you've been eating, sugar. Carbohydrates are by far the most common cause of gastroesophageal reflux disease. How do we get carbs into our body? Vegetables, fruits, and processed foods. Annotated and summarized. Easy to share with loved ones. The description below the title for this video has these summary points.